Limb-Girdle Muscular Dystrophy, LGMD, is a group of inherited diseases that make the muscles around the hips and shoulders, the limb-girdle area, get weaker over time. It usually starts in childhood, teen years, or early adulthood. Think of it like trying to lift a grocery bag. At first it feels easy, but as the muscles lose strength, it becomes harder and harder to do everyday tasks. LGMD is caused by changes, mutations in certain genes that tell muscles how to make important structural proteins. These mutations can be passed down in an autosomal recessive way. Both parents carry a hidden copy or autosomal dominant way. Only one parent needs to have the change. It is similar to a typo in a recipe. If the instructions are wrong, the cake muscle doesn't turn out right. Typical signs are trouble climbing stairs, rising from a chair, or lifting objects overhead. A waddling walk because the hip muscles are weak. Muscle pain or fatigue after activity. In some types, heart or breathing muscles can also be affected. For example, a teen who used to enjoy playing soccer may notice they get tired quickly and cannot run as fast as before. Doctors diagnose LGMD by checking strength, measuring a blood enzyme called CK, which rises when muscle breaks down, doing an EMG, which is an electrical test of muscle, an MRI of the muscles, and confirming the exact gene change with genetic testing. Treatment does not cure the disease yet, but it helps manage it. Physical therapy, with simple home exercises like standing up from a low chair, repeatedly keeps muscles flexible. Braces or shoe inserts support weak legs. Regular heart and lung checkups catch complications early. In some cases, medicines such as steroids or newer drugs are used to slow muscle loss. Because LGMD comes from the genes you inherit, it cannot be completely prevented. The best ways to reduce risk for future children are genetic counseling for families with a known history, carrier testing for adults who have an affected relative, prenatal or pre-implantation genetic testing for couples who want to know if an embryo carries the mutation. Early knowledge lets families plan and start monitoring right away. Gene therapy trials that deliver a correct copy of the faulty gene using a harmless virus, similar to how some COVID-19 vaccines work. CRISPR-based research that aims to edit the mutation directly in muscle cells. Development of antisense oligonucleotides, tiny DNA-like molecules that can skip over the bad part of the gene. New drugs, such as vamorolone, that may reduce muscle inflammation with fewer side effects. These studies are still in early phases, but they give hope that one day LGMD could be treated